Good evening, everyone. Welcome to the Waiver Reimagine event for this evening. Thank you all for taking time out of your evening to participate in this event. My name is Jill Lipsky-Kane, and I'm with the Improve Group. We are hosting this event in partnership with the Department of Human Services Disability Services Division. The topic for this event tonight is individual budgeting, understanding support ranges. So this event is part of a series of events and communications with what's called Waiver Reimagine. If this is your first introduction to this Waiver Reimagine, or if this is your first event, we'll provide that an overview of that during our presentation this evening. If you are familiar or have been to previous events, it'll be a good refresher. So this event really is about creating the space to gather your feedback. And so this event is focused on the future of people's budgets, and that we will discuss plans to transition to support ranges, also known as individual budgeting. So this event is hosted by and facilitated by the Improve Group. I'm joined by my colleagues Amy Sear, Carissa Propson, Russell Barnes, and Jim Nord, who's doing technology support. You can chat with him. You may already be seeing chat messages from Jim, as well as Kylie Nicholas, who's our event coordinator this evening. And the folks from the Department of Human Services Disability Services Division this evening are Megan Lindblom, Hannah Lamb, and Maria Trueblood. All right, so this is, again, like I said, an event about feedback and asking questions. The feedback that you share tonight on the proposed changes that DHS is talking about tonight about support ranges, the feedback that you provide will influence the plans to transition to those support ranges. DHS is still working on these plans, and that there'll be more opportunities to provide input and stay engaged. We can also answer some questions about the information shared today, and that we're recording all questions for DHS to then respond to in a link that's provided here of the frequently asked questions page. And in that page also has questions that were raised in the previous events on different topics. One thing I will also say too is that the chat feature in Zoom, you are welcome to submit questions on this topic of individual budgeting or support ranges throughout this evening. And that there'll be points throughout the event where DHS will take a moment and share back responses to those questions. So for technology tonight, we are recording the presentation in the large room here, and we are in the large room, if you will, but the small groups are not going to be recorded. You will have a small group facilitator who will be taking notes, but the recording is only of the main room presentation. I'll say it again so that you can communicate with DHS staff at this event using that chat feature in Zoom. If you are just on the telephone and you have a question or a comment, you can raise your hand by pressing *9 on your keypad. That is for anything, for anyone here in the room too. If you have any technology needs or any issues, go ahead and chat, or if you're on the phone, raise your hand. Participants, so I will say in terms of the chat is that while DHS is presenting responses to questions, we're going to be putting those questions and DHS's response in the chat. So you will be able to see that as they are answering questions throughout this evening. But the chat is not seen publicly, if you will, during the event. But your chat messages are going directly to our event staff who are fielding those questions. Next slide, please. All right, so just a couple guidelines for this event is just asking folks to stay on topic when asking questions or giving feedback. We can certainly use a parking lot for any ideas or questions that are not on topic. And that, again, we will have Waiver Reimagine has a frequently asked questions page where questions and answers will be placed. And then just some participation guidelines is about being respectful towards participants and hosts. And this is really about creating a space for people to express their ideas, express their thoughts and feelings. We want to hear you and we want to listen. And so we're just making sure that everyone just is respectful to share the space and not be rude and things like that. So a couple other pointers too is to assume good intentions and have good intentions and offer ideas and solutions as well, and not so much judgment. This is about really sharing and expressing your thoughts and opinions and experiences and points of view with these guidelines in mind. Thank you. Next slide. All right, so the topics for discussion at this event is that we're going to be presenting plans for support ranges or individual budgeting under Waiver Reimagine. And we will define support ranges, describe their development, and gather your feedback and questions. And so that is the focus for tonight, the topic. Next slide. The following are really important topics, but not to be part of the event specifically tonight. And those important topics are coverage of a specific item or service, the function of the MnChoices assessment, the workforce staffing shortage, COVID-19, the housing and economic crises, and also important, but not the focus for tonight, are any specific budget amounts, as those are still being finalized. Next slide. All right, so our agenda this evening, it is a 2-hour event. I will kind of come in at about the halfway point and let people know that you're welcome to take a quick bathroom break or stretch break at any point, if you by this point I've probably gotten used to being at online meetings that you can step away if you need to. So I just wanted to put that out there that it is a 2-hour event. I'll do a brief reminder before we transition to small groups if you need to take a quick break, but if you do need to do that on your own, by all means. So we will first start off with an overview of Waiver Reimagine and talking and getting that set up for support ranges. We'll then have a specific period for questions and answers. And then we'll return again to a presentation that'll focus on the actual support ranges and descriptions that have been drafted. We'll spend about 35 up to maybe 40 minutes having the small group discussion. And after that, we'll come back to the main room here and do a little bit longer session around the key questions and answers. And then we will close out our event at 8 o'clock tonight. At this point, I'm going to pass it over to the folks here from DHS who will provide a brief overview of Waiver Reimagine. Thank you.
Hi, good evening, everybody. My name is Maria Trueblood. I use she, her, hers pronouns. And I will be doing a brief overview of Waiver Reimagine as a whole project before we dive into the support ranges. Next slide, please. So on the slide titled Vision for the Future, you'll see the first bullet point provides a YouTube video, which is an introduction to Waiver Reimagine that is done by our DSD Disability Services Division Director, Natasha Mers. And so just some background about why are we moving forward with Waiver Reimagine. So DHS has heard from people and families that Minnesota's disability waiver programs are complicated and limit their flexibility. In response, we are working to make the waiver system easier to understand and use. Waiver Reimagine will streamline the system so people and families can focus on the life they want in the community. So a goal of Waiver Reimagine is to improve the disability home and community-based waiver system so that there is more choice and control over services, so that it is easier to understand and that it is simpler to navigate. Waiver Reimagine does not affect your eligibility for a waiver. All of the eligibility criteria will be remaining the same as we go through all these different steps. And these changes are happening in phases over several years. So right now we are in sort of that phase 1 where we streamline the services, and there will be a couple more steps before we get through Waiver Reimagine. The ideas that we're talking about today, these would happen in that later phases of Waiver Reimagine. Next slide, please. So on this slide, you'll see the reshaping of the waivers. So today we have the 4 disability waivers reflected on the left side of your screen, and they will go into 2 waivers, the individual support and the residential support waivers. Both the individual and residential support waivers will encompass the 4 levels of care and other eligibility criteria that are currently associated with the 4 current waivers. As a result, eligibility requirements will remain essentially unchanged for people who use services. This is intended to create unity between the 2 waivers, increase equity, and make them easier to understand and navigate. Next slide, please. And just looking a little closer at the residential support waiver and individual support waiver and how you would access which one. So on the left, the residential support waiver, if you receive a service that would be called community residential services, family residential services, integrated community supports, or customized living, that would have you accessing the residential support waiver. And if you were living with your family or living in your own home or living independently, that would put you on the individual support waiver. And there are many services that we aren't talking about when we're splitting these 2 waivers apart. Some of those services, like employment services, day supports, intervention services, and environmental accessibility adaptations, will span both the waivers, and you'll have access to them just like you do today. And then those ones under the residential support waiver would only be available if you were on the residential support waiver. Next slide, please. So just a quick run through the timeline of Waiver Reimagine, where we've come to where we are going, to help you put into context that this is a multi-year, multi-step process that DHS is undertaking with many, many people in those conversations. So in the past, how we got to today is that in 2017 and 2018, we conducted extensive research and stakeholder engagement, which informed the Waiver Reimagine legislative report and recommendation. In 2019, simplifying the service menu changes were passed into law. So now we are in the present, in 2020, we are continuing to research how to reshape the waivers, the support ranges or individual budgets, and self-direction, as well as conducting more stakeholder engagement events to inform policy and a second legislative report. And in the future, what does our future look like? So in 2021, the simplification of the service menu changes will take effect January 1st of 2021. And then we will publish the second Waiver Reimagine legislative report with more detail on reshaping the waivers, support ranges, and self-direction. And then looking at the years 2022 and beyond, we need to, after we get legislative approval, submit plans to the Centers for Medicare and Medicaid Services, and then begin implementation in 2023 or later. So talking today about support ranges, we're talking about an implementation date of the year 2023. Next slide, and then I will hand it off to Hannah.
Great, thanks, Maria. My name is Hannah Lamb. I use she, her pronouns, and I work for the Disability Services Division on the fiscal policy team. And I'm gonna dive right in, and we're gonna start talking about support ranges, otherwise known as individual budgets. Next slide, please. So when you all registered for this event, we sent out a pre-event input form or a short survey to start the conversation about waiver budgets and service costs. So one of the questions we asked was, how much do you, or if you're a family member of someone who accesses waivered services, how much do you know about your family member's current service costs or waiver spending? So the results are here on this slide. 96% of respondents reported that they or their family member who access consumer-directed community supports, or CDCs, share that they know a lot or some about their own or their family member's service costs. So almost all of them. Contrast to that, about half or 55% of people who do not use CDCs, that would be people who do not use self-direction right now and just access what we would call traditional services sometimes. And their families responded that they know a lot or some about their own or their family members' service costs. So those numbers make sense to us because, and I think they'll make sense to you all as well, because when you use CDCs or consumer directed community supports, you're given a set amount of money or a budget to spend from and develop your service plan. And so it makes sense that everyone who use CDCs and their families would really know their spending really well. Whereas people who don't use CDCs, budget and funds and service costs are not always a part of the planning process right now. So only about half the people do. So we'll kind of get more into that in the few slides of CDCs, but I just want to draw your attention to that. And we also asked, would it be useful right now for you to know how much your services cost? And everyone pretty much said, yes, it would be useful. 98% of people who use services would like to know about their costs. So that was also really good news to us and the fiscal team that works on budgets, because we know now that people will find it useful to know about the cost of their services and how much they're spending. And that's where the future of Waiver Reimagine is going towards. So that's exciting. Next slide, please. So we also asked a question to our lead agency representatives who registered for this event, lead agencies being the counties and the tribal nations that administer the waiver programs. We asked them, do the people you serve, are they concerned? Are they worried about their waiver spending? Do they have questions about it? And about 78% of people said yes, the people they serve have at least a somewhat high level of concern about their waiver spending. So we know these conversations are happening and there are a lot of questions out there. So our key takeaway going into this event is that people and their families care a lot about spending and they think it is important to understand. And lead agency representatives know that those they serve continue to have concerns about budgeting and spending. So that's why we're excited to talk about this tonight. Next slide, please. So to start, Waiver Reimagine and support ranges. As Maria said, Waiver Reimagine's goal is to create a more equitable and transparent system for people with disabilities. So when we say we want to create a system that is more equitable, that means it would treat all the people the same, regardless of what county they live in or what their diagnosis might be. People have shared with us that the system right now does not do that. People feel that the county they live in determines their access to waiver funds or what they can spend their money on. And to a certain extent, this is true. So Waiver Reimagine is trying to address that important issue. So we are including under Waiver Reimagine, we're proposing as part of phase 2, a new way to determine waiver funding that would be based on a person's needs and not on which county they live in. And so this new method would assign each person what we're calling a support range. And each support range would have an associated budget range. Next slide, please. So before we dive into what our proposal will be for the future, let's talk about how we currently budget waiver funds in Minnesota. Currently, and when I say budget or funds, I just mean money that pays for waivered services. And that's a combination of state and money we get from the state and money we get from the federal government. So currently there is not one specific way to determine how much a person will or can spend on their traditional waivered services. Instead, each lead agency, a county or a tribe, balances people's waiver spending together within a single lead agency budget. So this means that each lead agency has a certain budget determined by the state and a variety of factors, and they monitor the spending of all the people within their county and make sure it stays within that budget. So each person has services authorized that they need, and it's kind of balanced among the county. So that's why people feel like the county they live in might have an effect on their services that are authorized. So that's one way could be determine how much a person might spend. Another way is people who self-direct their services, like I was just talking about before with CDCs. So right now, if a person chooses to self-direct their services and use consumer-directed community supports, they are assigned a given amount of money, what we call an individual budget based on their min-choices assessment. And then their case manager, and they plan their services within that amount of money. So we want to keep calling out CDCs because many people with that, they're already our individual budget experts, right? They're familiar with the idea of getting a set amount of money and then choosing the services that they want that fit their needs based on that. The new budget ranges or support ranges that we're discussing tonight, they use a different methodology, different math to determine how much it is, and we're still working on developing the numbers. So it'll be different than CDCs, but kind of the idea that you have a range of money to service plan with, that idea is the same. Next slide, please. Something to point out is that Waiver Reimagine isn't changing, and in support ranges won't be changing everything. Waiver Reimagine will not be changing the disability waiver rate system, otherwise known as DWRS by the acronym. Most services have rates set using this system, and Waiver Reimagine and support ranges will not be changing how rates are determined. The support ranges will just be another part of a person's waiver planning. Their unique goals and their needs will still be the central part of the planning process. And finally, a person's support range determines their spending, but not what supports they choose. They still, along with their case manager and their family or their chosen community, they choose what services best fit them. So the person's support range isn't going to limit that. Next slide, please. So that's kind of how the current lay of the land is. And now this is a slide that it moved around a little bit in your packet if you're following along. We kind of moved it into this section. It was previously slide 8. So in case you're wanting to refer to your packet. These are just a list of our terms that we'll be using that you can keep referring to because it's kind of a lot of new information. And talking about budgeting and money can get confusing, so it's good to just have them all on one slide. And that reminds me to keep chatting questions. Hopefully you already have been. You can use the chat function to chat any questions about what I'm presenting right now. So support ranges, what are they? These are the levels of a person's need based on the min-choices assessment. And we will look at the proposed support ranges for adults and for children in a little bit. And a support range description goes along with each support range, and it describes a person's need across multiple areas or domains of their life. Their narratives, just a few sentences, and just kind of work to describe what someone may, what supports they need, how it might interact with their community, what kind of their needs are that might drive their services or supports within each support range. Also in your handout that came along with the invite is 4 examples of different support range descriptions for different levels of need across different ages. And a budget range. So each support range has an associated budget range. These budget ranges, which are still under development, are being determined with qualitative and quantitative analysis. So what that means is the quantitative part is we took a look at years of service authorizations and rates and spending using real data from people alongside the qualitative information, which would be looking at assessments, support plans, talking to people to develop these budget ranges. So each support range will come along with an associated budget range. Next slide, please. So like I said, people would be assigned to a support range based on their assessed need from the min-choices assessment. This kind of sounds familiar to CDCs users, as I said, but the key difference is support ranges are not determined, and the budget ranges are not determined using the same method as CDCs. And we'll keep coming back to that throughout this presentation. The support ranges offer spending flexibility, and they incorporate current rates and service use data. So because they incorporate the amount of current rates and how people are actually using services, along with many domains and questions from the Min Choices assessment, not just a few here or there, they're more stable over time, and we can better predict spending, and people can better know how much they have to spend. And if a rate changes or a Min Choices question changes, we can change the support ranges along with them, so they can kind of remain stable over time. Next slide, please. All right, so how is a person placed in a support range? There is a lot of statistical and math work that I won't get into that is highlighted in our 2018 legislative report, and we'll again go into for the one that will be published in January. But the way to understand it is it's a combined score across each area of the Min Choices assessment. And the three main areas are, you can see on your screen, the three squares leading to the support range are general support needs, behavioral support needs, and health support needs. So general support needs are those questions about ADLs, or activities of daily living, and IADLs, which would be instrumental activities of daily living. Government loves acronyms, right? So ADLs, activities of daily living, would be like toileting, getting dressed, taking a bath, things like that. IADLs, instrumental activities of daily living, would be more about medication management, financial planning, things like that. So your score based on the questions that are asked and what's discovered during the Min Choices assessment create a general support needs score. The health support needs are support needs having to do with someone's health, like needing help managing an allergy or a feeding tube, something about someone's physical health. And the third area is behavioral support needs. In the Min Choices assessment, they use the word psychosocial instead of behavioral. We prefer to use the term behavioral, but if you see in the report, or if you look at your own Min Choices assessment, it might say the word psychosocial. You can know that those are interchangeable. Those mean the same thing. So that would be needing a behavioral support need might be that you need an intervention around a certain anxiety trigger, or you want supports when you go out in the community, managing, supporting positive behavior, something along those lines of behavioral support needs. So again, it's a combination across many different areas, across many questions of Min Choices in these three areas. So no single question or a handful of questions, determines the support range. Like if you answer this question this way, you're immediately put here. It looks really holistically at the person throughout all of the Min Choices assessment. Next slide, please. So how did we come up with these support ranges? How do we develop them and refine them? So we've been working on them since 2017, as Maria said in her timeline. We've done a lot of research, kind of math and statistical analysis, reading how other states are working with their individual budgeting. And we had probably the most important part would be what we call expert panel work. And we had one in 2018 and we had one in 2020 over the summer and into the winter. It looked a little different, obviously, to be virtual because of COVID-19, but the expert panel consists of people and advocates, lead agency staff, providers, doing a variety of activities with us. And they helped us write the support range descriptions, help develop criteria to determine who might go where, consider different service needs and mixes of services, and then helping adjust the final budgets will happen in the future. Next slide, please. So, oh, and then for the previous slide, I forgot to mention that a big part of the expert panel work is doing engagement events like this one to get feedback about the support ranges. So that's just continuing to check our work with you all. Okay, so support range descriptions. you have some examples in your packet, and we'll go into them more in the small group discussion, but they describe a person's needs across multiple areas or domains of their life. The descriptions are based on real people's lives, hopefully making them a little easier to understand. They use I statements, and you'll see like, I may need this, I may need that. They're meant to be representative of everyone who might fall into that support range. So you might recognize yourself or someone you know in some of the phrases and not all of them. We plan to post these publicly along with the budget ranges once they're in effect to kind of increase understanding and transparency for people in their planning, so they kind of know all the different support ranges, not just the one that they're in. We're still developing them, gathering comments through activities or engagement events like this one, so they're not posted yet. Next slide, please. Okay, so the different kind of domains, they call them life domains or areas, of the support range descriptions were developed from Charting the Life course, which many of you may already be familiar with. If you're not, Charting the Life course kind of was a grassroots activity driven by people with disabilities and other advocates and university research. It helped me to understand it when I read the question on their website, that they started with the question, what do families or people need to know to support their family member with a disability across their lifespan? And now it's, developed into something much more than that, that people can use, and people of all ages and abilities can use to develop their vision for what a good life is. It's kind of looking at these 6 different areas of someone's life, thinking, what do they need? What are their activities? And then thinking about what services and supports kind of match with those. So the 6 domains or areas are meaningful day in employment, community living, safety and security, healthy living, social and spirituality, and advocacy and engagement. So again, if you want to review those in your handout, there are some examples there. Next slide, please. So here is just a zoomed in shot of something that is in the handout, which is a support range description example. So these are just from 2 life domains of an adult support range. And you can see the I statements, and it's just about, what does this person in this support range, what might they need to have a good life when it comes to their safety and security? What might they need when it comes to having a good life with citizenship and advocacy, to feel like they're really enfranchised and that they can advocate for themselves? So they may feel a little generic at times because they're meant to apply, just kind of give people a general idea of what each support range might be. And next slide, please. All right, so another reminder, keep using the chat function. I'm also looking at the questions as they come in, so it seems like we are getting a lot of good questions, which is awesome. If we don't have time to answer them all, again, I'd like to point you all to go to the Waiver Reimagine website, where we continue to update frequently asked questions after all these events. So I will pass it off to Megan.
Thanks, Hannah. Hi, my name is Megan Lindblom. I'm Fiscal Policy Lead at the Disability Services Division. Before we get off the slide, I'm going to take a minute to just read out a couple of the questions you guys have been asking. You are on fire tonight, asking lots of really good, tough questions. So thank you for that. Keep it up. We learn from you and the questions you have. So this is a great opportunity. I think Jill said it right in the beginning. Tonight is about hearing from you and your questions. So I'm going to do a couple, but you guys have been on fire and there's a lot more. So when we get to the end, we'll do that as well. So first question out the gate we have is, does DHS suggest that the new structure, which we assume is the waiver structure here, will support those in outstate where the needed services may not be available? And, in the development of this over the last 3 years, I think the one thing we were really asking ourselves is, how do we meet the needs of everyone across the state? And that might look different in different areas, especially in the outstate where we may have pockets that service just aren't available. And I think one of the things that maybe we haven't talked about in depth tonight, but we have in other parts of these events, is that, you know, we're opening up self-direction. And I think that's just such a great opportunity. If you're in a place where the supports aren't formally available for you, there's always the option to take on some of the role and find someone in your community that can provide your supports, right? Moving into some self-directed services, but not all. There's a lot of other pieces to that, but I'm not going to elaborate too much. There's a lot of content. I continue to want to point you to our Waiver Reimagine website, which we've talked about a few times. There's tons of great information like that. Another question kind of about our giant state that we have budget ranges, our budget ranges set on geographical location. There are cost differences in where people live and what they have access to in rural versus metro, which is exactly true. And I want to say, yes, DHS has taken into consideration the regional variance costs across the state, just like we do in DWRS or in our rate system today, right? Things cost different amounts across the state. So what happens if a person is living in their own home on a DD waiver or using a DD waiver? And the answer is that this person would be considered to be living independently in their own home. So they would be moving on to the independent living waiver. So that really, because their DD doesn't define which waiver they'd be going on to, but they're living independently. So that's where they would be served. We have another question of who will assign the support range. And I think Hannah did a pretty good job outlining this, but I want to echo what she said is a person's support range is determined by their assessment. And that support range will be assigned based on the needs that are determined in the 3 domains: general support need, which is those ADLs and IADLs, their health support needs, and their behavioral support needs. And then we also had a question about under the new system, would I have access to an assessor who is familiar with autistic kids, or especially needs of high masking autistic women or non-binary people? And while this is a little outside of scope, I just want to take a moment to call out that this project itself is not changing the assessor role, or we don't really even have domain over that. We're working very closely with the team and the experts that work with assessors and how that program works, but we are not determining how those things may or may not be changing. So just again, wanted to point it out that while that isn't necessarily in scope, I do want to say there are a lot of things that are in scope, but sometimes there are things that are not in scope here. And so that's not something that we're going to be able to have any input on in this conversation, just to call that out. So those are just a couple of good questions. I'm going to jump into my content now, but keep asking these really great hard questions because they're going to help us do better by you in the end. So thank you. And I'm going to ask for the next slide, please. So Hannah's been doing a really great job of outlining how we got here, what's the current status today. And I just want to take a moment to pause before I jump into my own content to point out something that we realized over the work that we've been doing since late 2017. And that is that, you know, one budget range doesn't fit all. And what we found is a meaningful difference is the difference between the needs and the supports for kids and the needs and the supports for adults. And for our purposes, we're talking about people who are 18 years age or older when we talk about adults. And so one of the things that we've done, especially over the last year, has developed the children's support ranges. And even to dig a little bit deeper in that, understanding that kids themselves, you know, definitely have a lot of development happening between the ages of 0 and 17, but even breaking down children even further. So we have 3 age cohorts that we'll talk about coming up here in a minute, both 0 to 5, 6 to 13, and 14 to 17. And these are just kind of our brackets of ages for kids. And we'll talk a little bit more about that as we get along. But first, I want to run through what these support ranges are and a little bit more detail on them as we have developed them for adults. So if I could get the next slide, please. So when we talk about support ranges for adults, I will harken back and say that this was part of our report at the end of 2018 and 19. And we've done some refinement, but these support ranges remain the same for those of you who have been part of this conversation for a while. And I want to also just take a minute and connect us back with one of the things that Hannah talked about, which was those 3 domains that the scoring for these support ranges is based off of, right? We have the general support need, which again, with our acronyms is the ADLs and IADLs, those personal needs that individuals have. And then also looking at scoring around people's health needs and people's behavioral support needs. Now, one of the things that we learned early on, and just have, you know, the ability to work through in doing this work and working with our stakeholders and experts, is that we understood early on in our work that there are additional needs for an individual who has high health or high behavioral needs. So even though we have a need for our general support, our ADLs and our IADLs, there needs to be another layer of support or dollars when it comes to someone's health needs or behavioral support needs. And so that's what you really see represented in this visual in front of you, right? Support ranges 1, 2, 3, and 4 are driven mainly by the general support needs of an individual. So someone who has a low general support need may not need a lot of hours of support or a lot of intensive supports, but when you get all the way up to 4, that's an extensive general support need. They may need help with a number of ADLs. They may need very hands-on supports. But in those ranges 1 through 4, we see that they have what we're calling typical health and behavioral needs. Now, we as humans are never typical. We are individual people as ourselves. I almost said individual humans. I'm just being duplicative now. So there is always a health need and there is always a behavioral support need. So there's not to say there isn't any, it's just within a typical range that we would expect. When we get into levels L and H, those layer on top of that general support need, like I talked about. So L really correlates with support ranges 1 and 2, kind of that low to moderate needs, but also layers on additional supports and ultimately dollars because we have a higher than typical support need when it comes to health and or behavioral supports. That plays out again with H. We see that happening. It more aligns with 3 and 4 as far as a general support need, but again, layering on those additional support needs with dollars. And then we get to E, which has a lot of indicators in it. And what we've really found after studying and modeling things statistically, not going to get into the nitty-gritty there, but lots of stats, is that it's really any general support need. Someone could have a really low general support need, but have what we call extraordinary health and or behavioral support needs. And extraordinary is a hard word to chew on because it can mean a lot of things. But as we look at how we break down ultimately what is scoring within the Min Choices assessment, in support range E, what we find is that those individuals just have very, very high health or high behavioral needs, which is even beyond what we see for people inside of the L and H support ranges. So just to talk through that a little bit more, these are our 7 base support ranges for adults. Now there are more than one categories of these, as Maria talked about. We've got 2 different waivers, so all support ranges are served on both waivers. So when we talk about the support ranges for adults, we're talking about 1, 2, 3, and 4, L, H, and E. So next slide, please. And so as Hannah alluded to, each one of these support ranges has a support range description. And so this is the specific language as it's drafted today. And of course, nothing's final, and there's more feedback to have from all of you as well as the broader community. But these are as we've drafted today. And this is for someone who is an adult who would be in support range 2, right? So a moderate general support need with typical health and or behavioral support needs. And so looking at those same categories that Hannah outlined for us, these are really kind of a narrative voice to talk about the supports that I would need if I was someone who was in support range 2, right? So for my safety and security, I may need education about emergencies, about being home alone, identifying unsafe scenarios, so on and so forth. I won't read them. You guys have a packet. I don't need to read to you all tonight. But, you know, that seems kind of vague, but it's meant to be vague because this isn't a portrait of one individual, but a group of individuals that have like needs, right? One way we would maybe see this change is if we were looking at an adult who is in a support range 4, maybe we would see this come out as something like, I need education about emergencies, I need supports to be in the home so I can be safe in an emergency, or maybe I need physical assistance to leave my home or to leave an unsafe situation in my community. So these things again, are somewhat vague, but are used as a guidepost for the conversations and understanding what the support ranges are. Next slide, please. So now we're going to shift gears and we're going to talk about our kids support ranges. I may use children, kids, or kiddos. We have lots of terms, but overall, this is our under 18 population. And so like I mentioned earlier, there's 3 groups or cohorts of ages, and it's really trying to align kind of that parental role or the independence growth that happens for kiddos over time, right? Someone who is 1 is much more dependent on their caregiver or their parent than someone who is maybe 13 or 15 who wants to be hanging out with their friends. I don't think kids go to the mall anymore, even if there wasn't COVID, but they do things out in the community. I am not cool or hip enough to understand what is done by the teens these days. But when we're talking about ages 0 to 5, we've got 3 support ranges here. And you'll notice that they do align with our adults, and they're not exactly a direct translation. But they're familiar, right? We have our L, H, and E here. And the reason we have condensed those is because when we looked at our population of kiddos 0 to 5 today, what we noticed is that kids coming onto the waiver in that younger age category tend to have, as a general rule, not an exclusive one, have a higher health and or behavioral need that's really driving their access to the waiver at this age. And now that doesn't mean that kids don't come onto the waiver because of their general support need, that's for sure. But almost all are coming on with really high health needs, those medically fragile kids, or those high behaviors where they really need a lot of support, especially for the family dynamic. And so you'll see L has children with a low to moderate general support need with or without high health and or high behavioral support needs. So again, it's a little bit more broad of a category, but follows the same methodology. Next slide, please. When we get into children's ages 6 to 13, you'll see that the support ranges start to broaden a little bit, right? So when we talk about the younger kiddos, they're really coming on because of those high health and or behavioral needs. But when we start to get into the older kids, we see them maybe being driven by a general support need as well, right? When we get into 6, that's usually like kindergarten, 1st grade. Those kids are out starting to live their lives outside of the family home. They may be gaining independence, and that's sometimes where we need more supports for these kids. And so thinking this through, we have a support range, of 1 and 2. And 1 really encompasses what we would think of in the adult lane as probably 1 and 2 together. We have that low to moderate kind of grouped. And then with 2 for kids this age, we see that high to extensive general support need. And again, that kind of encompasses what would be 3 and 4. So we just got a little bit of a condensing here. And then we add on L and H just like we do for adults. So that goes from that low to moderate general support need and then adding on the high health and or behavioral need. We do want to just mention, we understand that 6 to 13 is a pretty broad range. You know, what a 6-year-old is capable of and what a 13-year-old is capable of can sometimes vary greatly. And I will say this is a place where we aligned with the Min Choices assessment as it is today. This is a current age cohort that exists, right? And I'll talk about why that change goes into 14 in the next slide. So if I could see the next slide, that'd be great. Thank you. So the next age cohort is 14 to 17. And you'll see that those support ranges are exactly the same as 6 and 13, but there's a little asterisk down at the bottom, and I really want to talk about that one there, is that the methodology behind these same support ranges is different because the change between 13 and 14 in the assessment today is that we start to consider the support needs for an individual on their IADLs, right? So this isn't just now their need for help with support and eating, but also maybe chores that they're helping with around the house or communicating on the telephone. You know, we might have kids who are in their teen years who have to take out the trash or shovel the driveway. And because that is something that we would expect from a person without disabilities, we want to make sure that we're building in all of those assumptions for people with disabilities too, right? That independence needs to be there, and they need to have the opportunity to grow and also get supports for the family or themselves if that's not a capability that they would have. So that's really where that additional layer comes on and why those cohorts are broken up the way that they are. So not going to drone on that too much, but those same things are happening in these 5 support ranges you see, right? You have general support needs with low to moderate, but that general support need now includes the IADLs as well. So next slide, please. And so just to kind of circle us all the way through, talking about a support range description example, we have them for adults, and for each one of these age cohorts, we have them for kids as well. Again, they're slightly vague, but they're really tailored to the needs of the kids at that age, right? As we talked about, kids who are 1 versus kids who are 16 have different independencies, different tendencies, independence and dependencies. Sorry guys, it's getting late and my coffee's wearing out. But we want to make sure that we're understanding these as the visual and the understanding of what an age is, as well as the support need there. So when we look at this as the support range L for ages 6 to 13, right? So I need to learn safety and decision-making skills for my own safety and security, and I may rely on my parent or caregiver to help me make safe decisions. And while, you know, if we think about the 14 to 17-year-olds, we may have similar language there, but it may also talk more about those independent pieces that we saw in an adult support range of a similar nature, also talking about learning what to do in those settings, or when I may be in the community and I need to identify an unsafe situation. So you can see how those can grow with the group as they age into different cohorts. So next slide, please. So before we wrap up our content tonight, I just want to spend a little bit time talking about support ranges and the consumer-directed community supports and what will be self-direction in the future as well. So Hannah's hinted on this a little bit already, so I won't belabor the point too much. But people who are using the current self-direction option on the disability waivers, which is consumer-directed community supports, also known as CDCs, you guys are our experts. You are individual experts who know about what it is to have a budget and how to plan those services. However, support ranges wouldn't be determined by the same methodology as CDCs, right? This is a different methodology, and I won't get too technical, but today CDCs is calculated based on an algorithm that pulls a few different factors in from a min-choices assessment and then calculates out an individual budget, which means that you or your neighbor both may be on CDCs and have absolutely different dollar values. That isn't exactly how it works with support ranges. They're groupings, and they have a consistent scoring across all, and it aggregates up a score instead of maybe pulling your one toileting score and your one mobility score. We look at you as a whole and broad picture. So those budgets today are really different for people who are on traditional services, right? They don't have an individual budget. It's about the lead agency budget and planning everyone's services within a limit there. But under Waiver Reimagine, we proposed that support ranges would be the same across all users. So if you're someone who comes in the door and you're already using CDCs and you want to keep using self-direction, you get your support range and you start planning just like you would. Or if you're someone who uses traditional services, you come in, you get your support range, you have a budget, and now we start planning your services just the same way. Can you get the next slide, please? And then just to talk about kind of the intermediary of what I had just laid out, right? You might be a CDCs person today, and that's where you want to keep going. You'll get your budget amount after a new assessment that's based on support ranges, and you'll start planning and you're good to go. And you may be somebody who has traditional services and you get support range and you start planning and you're good to go. But as we talked about in our last meeting, if you came to those meetings, we talked about opening up self-direction. And now that everyone would be on their own individual budget, we have the opportunity to say, if you want to try on self-direction, maybe try a service or two. That's really opening it up and letting you plan a full support plan that makes sense for your life. And if it's some self-direction, all self-direction, or no self-direction, you have that opportunity. So I think I'm going to hand it back to Jill to keep us moving along.
Great, thanks everyone. This is Jill speaking. I'm going to transition us to the small group discussion activity for the evening. So let's see here. Next slide, please, Jim. So the process is that you'll be moved to the breakout room, and the improved group facilitator, I'm one of those, and I'm joined by my colleagues as well, who will be your facilitator. And we're going to spend, let's see here, it's 7 o'clock. It looks like we're going to definitely have the 40 minutes for sure for our small group discussions. And we will let you know how much time is left for the small group. And when that time is wrapping up, and it goes quickly. We did an event earlier today and it went by very fast. Lots of great discussion. We look forward to having those discussions tonight. And when the time is done, then we'll just automatically be sent back here to the main room. All right, so at this time, Jim, please send us into our breakout rooms. All right, welcome back to the main room. We had a really lively discussion in our small group. Maybe some other groups were had similar themes. I look forward to hearing what people's questions and comments were and from the small groups. We can now go to hearing what questions have come up already through the event and give DHS an opportunity to respond to them, and give you all the opportunity to continue using the chat to send in your questions. That where are we at in terms of time right now? So it's 7:41. We are going to end the event tonight at 8 p.m. as planned. So now we're going to spend most of the time before we close for the evening. We're going to spend most of the time with this question and answer activity here with DHS responding back to questions. Again, this is Jill, and I'm going to pass it. Hannah? I'm looking at you, Hannah. Are you ready to field it from here?
Thanks. Yep.
Thank you.
All right, so we got a ton of awesome questions. And so we won't have time to go over all of them, but continue to look at our public page because we do post after each of these events and update those, but we'll try to get through as many as we can. So the first question was, again, what exists now is quote unquote an individual budget. So how are ranges now being identified as individual budgets? So I think this is a question more about CDCs and an individual budget. So people on traditional services today, meaning that they don't self-direct or use CDCs, they do not have an individual budget. For disability waivers, there's an individual budget for CDCs. Those using those CDCs budgets currently are calculated based on an algorithm. So does the next question is, do we DHS project that the budget ranges will be the same, greater than, or less than what people are currently receiving? And that is a great question. So the amount of support ranges and the associated budget ranges are based on current spending of individuals on waivers today. While they will meet the needs of most individuals on the waiver, there is always a possibility that some individuals would see small decreases in services or spending ability. However, the budgets are anticipated to meet the needs of the vast majority of individuals based on their current spending. How do you know, how does DHS know what service use data is if we don't exactly know where CDCs is being spent? That's a good question. I think under the CDCs program, there are types of spending, kind of spending buckets, we call them, spending categories, just like in traditional waivers. There is available data on CDCs spending to track and understand how individuals are supporting their needs under those various categories. Min choices, the question is, well, min choices determines the quote unquote range. How is this an individual? What if a given team disagrees with the min choices assessment? So people always maintain the right to appeal their min choices assessment. That process will not change with Waiver Reimagine. And if a change of condition occurs during the year, like your health changes or your enter hospital and leave. An early assessment before the reassessment should be completed to reflect this change, just like it would be today. Min-choices assessments should be completed based on the person's needs and their life being assessed. So that will not change. Another CDCS question was, am I understanding that there will continue to be CDCS and traditional waivers? Did I understand correctly that the CDCS budget determination will continue as currently done? So everyone on the waivers, whether they're using self-directed services or traditional services under our new proposed support ranges, will have the same support ranges, meaning that once an individual has their support range, they will have a budget range and they can plan services as they choose, whether to self-direct or not, self-direct some or self-direct all of their services. So there will be budget equality between CDCS users and traditional waiver service users. Let's see. Do these states, I think meaning other states that we referenced when we were talking about researching other states, do these states have similar services in place, not just on paper? For example, a state we moved from was not providing very many services and is on the list as being one that this is based on meeting the support ranges. So yeah, we researched many other states that's mentioned in our legislative report in 2018 to see kind of what worked there, what didn't work so well, and how Minnesota might use those experiences from other states. But we know Minnesota is very unique, right? In its in-depth and historically expansive disability services. So we can research other states, but ultimately we're not just gonna exactly go with what another state went with, because that would never fit for Minnesota. So we were pick and choose pieces of what works best for Minnesotans. So let's see. Oh my gosh, so many questions. Okay, will people in group living situations be able to choose people and items they want and need, similar to CDCS? I think people meaning like a caregiver, most likely. I think that was kind of similar to Polly's question. And yes, I will say Waiver Reimagine is currently planning on expanding self-direction to all those who use waivers wherever they might live. Currently, it is restricted to certain settings. So we're still developing the policy as to which specific services can be self-directed, but we want to ensure that everyone has the option to self-direct some or all of their waivered services, regardless of where they live. And in the chat now, when that question will be dropped, there'll be a link to event 3, which is solely about self-direction if you want to learn more about the policy side. We have gotten a lot of versions of questions about min choices and how that kind of the assessment will fit with assigning a support range, which are really great questions. So this question is one of those. How are the level of support needs determined? Will min choices results or the county assessor determine this? Kind of who will put you in a support range? What will put you there? The min choices assessment and not the assessor or the person from the lead agency will place you in the support range. The assessor plays an integral role, obviously, in administering the assessment, but the combined score across many questions and areas of min choices actually determines what support range you're in. So adding those 3 scores under general support needs, health needs, and behavioral support needs. The term general suggests typical. Is that what it is meant by general support range, kind of typical support range? So general support needs, when we say that, we mean the activities of daily living like eating, bathing, grooming, dressing, toileting, and IADLs or instrumental activities of daily living like housework, cooking, answering the phone, things like that. So that's what's meant by general when we say general support needs. We don't mean typical, we mean those ADLs and IADLs. The last question, I think, or a few more here. I don't understand how the CDCS budgeting will change for the new support ranges. Can you try to explain more? Thanks. So for CDCS users today, we don't anticipate much to change if you want to continue to self-direct all of your services. You will have an individual budget amount and you can plan your services within that amount. There will be, however, the same budget criteria for all people on the waiver. That means their budgets will be equal. And it just mentions again about the expansion of self-direction and looking towards event 3 and the FAQs there. All right. Okay, a few more here. still have a few minutes. How will DHS address the individual needs within these broad groups? And I think it's talking about, you know, how are we going to really create person-centered supports within these broad support ranges that might encompass someone with very different needs. So the needs of the individual will still be met through the support planning process that is currently in place. The support plan should meet the needs and goals of the individual. So the support range will determine your budget range, but the support planning will continue as normal with your case manager or you self-directing your services. Another question, when we say typical, do we mean typical for someone with disabilities? That's a really good question. Kind of defining our terms some more is always good. So typical health or typical behavior support, when we use that phrase, is meant to indicate a low to kind of non-existent amount of support needs in those areas. So it's not defined as typical for a person with disabilities or a person without, but that the overall health and behavior support needs are not kind of driving the overall support the person needs. They don't have a lot of support needs in that area. That's what we mean when we say typical. All right. Some math questions, which, as Megan said, we're the fiscal team, so we like them. Are you saying that this new structure does not use an algorithm? Yes. And what an algorithm is kind of Megan described before, is a few questions and you kind of put it into a formula and it spits out the number. These support ranges are based on aggregate scoring within the domains, not a specific algorithm that weighs and balances different responses people give. So this is different than that. That's how CDCS is. CDCS uses an algorithm. One question was, in the materials for this program, it would help to see more examples of adults with disabilities whose plan does not revolve around already having a parent or a family member providing care. What would their goals be? What would their services and supports look like? So there are support range descriptions specific to adults, the 7 support range age cohorts. Those will be available in the upcoming legislative report. The adult SRD support range description, they do have a focus that does not rely on parent or other family member supports, but they kind of aim at working towards independence for individuals as they might define it. So there will be extensive adult descriptions in the upcoming legislative report. Another question was, will there be a chance to move between 2 different waivers, the residential and the individual, if or when circumstances change? So this is referring to the fact that 4 waivers will become 2 waivers under waiver reconfiguration. So yes, there will be a process developed to move between the residential and individual supports waiver when or if a person's needs change. If you could see the Waiver Reimagine page website for additional information, including the FAQ, frequently asked questions page, and event 2, reshaping the waiver, you can watch event 2. As these processes are developed, please keep visiting this website. It will contain the most accurate information, but yes, there will be a process developed to help people transition. We got a number of questions about min choices, a lot of different scenarios. We will bring these questions and comments to the min choices team. We are not the min choices team. And we will keep these thoughts in mind as we go forward in our work. I just want to reiterate that Waiver Reimagine will not be changing the min choices assessment. Another question about CDCS. The question was the budget range. This is something I said. The budget range methodology for new waivers will be different than the CDCS budget methodology. And the person's question was, if this is the case, will CDCS budget type of option continue? If so, how will it work? How does it look different for those who would like to create their own budget and those who don't want to do that? Will the budgets for individuals on the 2 new waivers need to be supported by a fiscal support entity like we use for CDCS now? So those are all really good questions. For CDCS users today, we don't anticipate much to change if they want to continue to self-direct all or part of their budget. The person who uses CDCS will have an individual budget amount, based on your support range, and you can plan your services within that amount. There will be, however, the same budget criteria for all people on the waiver, whether they self-direct or not. That means their budgets will be the same. For Waiver Reimagine, there will be an expansion of self-direction options available to people receiving waivered services. So this will include the ability to entirely self-direct services, or just pick and choose which service they self-direct and which services you might use traditional services for. For additional information about self-direction or questions about the effects Waiver Reimagine will have on it, you can see the Waiver Reimagine website. Event 3 was totally about self-direction. And there's also a frequently asked questions section that was recently updated about self-direction. Another question was, do the L, H, and E levels kind of take over what used to be the NB, I think it's neurobehavioral level, for the BI brain injury waiver? So the L, H, and E support ranges, along with 1, 2, 3, and 4 for adults, are determined by the person's assessed needs. We can't make really a one-to-one correlation between the waiver or level of care a person has today and translate that into a support need. We would anticipate that people with maybe higher, more complex medical needs, like someone who has a BI neurobehavior level of care, might land in that LHE range, but there's not like a one-to-one correlation there. A couple people had, this question was asked in a few different ways about how we are defining extraordinary. For some of the support ranges, they use the word extraordinary need. And this person asked, please define extraordinary. One assessor may have an idea of extraordinary based on their experience, when another might, have been around for a while and that doesn't look very extraordinary to them. The subjectivity of assessors, that's a really good question. So yeah, the assessor will not be assigning the person the low, moderate, extraordinary. The assessor will not be doing that. The extraordinary comes from a combination of scores across the assessment, not one question or option that the assessor chooses. So no one question or a specific set of questions will lead directly to a support range. Extraordinary is defined as a collection of scores across the 3 areas: general support needs, health needs, and behavioral support needs. So it's not something that the assessor chooses or labels the person with. Someone had a question regarding how did this all come into play, these proposed changes, who initiated it, and why? Why is Waiver Reimagine happening? So originally this work began as a directive from the Minnesota legislature in 2017. And since that time, these changes have been developed with the disability community. So the changes that we're suggesting under Waiver Reimagine kind of are building on the 30+ year history of all these 4 waivers, as well as work over the past decade to develop more statewide standards. So really making sure that people throughout Minnesota had the same level of access. Waiver Reimagine and the proposed changes, it brings our responses to our collective learning and vision for the future of the disability waiver programs. And then I think I will pass it off to Megan for the last questions.
Yeah, so I think one of the themes that we saw through these questions was a lot about how do we define or how do we score, or what kind of pieces of the puzzle are the answers to understanding your support range, right? And I think this is a really clear place where what we talked about with CDCs, you have this giant math problem and you plug in your toiling score, your mobility score, and boom, there you go, right? It's connecting to specific indicators. That is not how it happens in the criteria here that we have developed, and we tried to not go too numbersy, but we wanted to just take a step back and clarify that, because I don't think that's a place we made clear. So when we built up this criteria, what it is not just one score here or one question in the assessment that's really driving that funding. It's looking at a holistic or aggregated picture of an individual, right? So if we take the idea of the general support needs scoring, when we look at that 1, 2, 3, and 4, you start to see a range of scoring, right? So if I have a general support needs score of 7 or less, that means I have a support need of 1. It's a lower support need, but that 7 score, and not to get too nitty gritty into it, that could be 7 all in mobility, or all in eating needs, or all in my ADL needs, right? And I may not have the physical needs that support a higher score, but it doesn't have to be in one place. And so when we talk about how that gradients up, right, you have a 7 or less. When it get to 2, you have an 8 to 19. And these are kind of abstract concepts, but we wanted to kind of point out how that works and how we build upon it, right? So the higher your aggregate score, whether that be all in mobility or all in toileting or all in eating, or be across many of those things, is really what's driving you into a support range. And so when we talk about that E category, or the extraordinary health and or behavioral needs, we're talking about the people who are having the highest scores in those categories, right? So if we look at, let's just use health, right? If you have a health score of 5 or less in all of the questions that are driving the health domain, then you would be assumed to have a, what we call, typical health need. Now, it's not a non-health need. It's that's within the range of what we would expect most people to have. Once you get in that 6 to 19 range, that's where you get into L and H. You have an additional need on top of that score that says, okay, well, there are higher health needs here. And so that person would need additional support for that. And then once you get 20 or above, that's what we're calling extraordinary. And I again, don't want to get into like the nitty gritty or where you personally would be. And I will say a lot of this was in the 2019 report. It's very dry. So, don't read it by candlelight at night. You might doze off if you're not a numbery person like myself. But you can also see how those things are driven in the scoring. So not to get into the statistics, but just to say, you can see how it builds up, right? Here's the score we have for our general support need, and it fits within this range. And then here's our health and our behavioral score. So it's not one question or 5 questions that you have to push into to get that scoring correct, to get to that level E, but that the needs build upon each other until you get to that extraordinary level. And again, extraordinary does not look the same between people, but the scoring and the min-choices assessment as it is today can define those criteria. And I've now pushed us past the hour, so I do apologize. I get excited about numbers and statistics.
Let's see, going more. I think that is all the questions we have, unless Megan and Maria. We're furiously answering them because some of them are still coming in, so we could kind of.
Yeah, you guys are just really good at asking questions. So we're like over here, like trying to answer them appropriately and give thoughtful responses. So more to come, but I don't know if we're going to be able to get through more. So we might want to hand it off.
We have, just real quick, I want to address that we've had several people bring up, what if you don't agree with your support range?
Yeah.
And we just wanted to remind you that the appeal process for min choices still remains in place. So you can always appeal your assessment. And you should be getting that every time you have a reassessment, you should be getting your appeal rights. And that would be how you would then dispute your support range, because it's tied to how you are assessed. And we are also developing an exception process for people who maybe do fit in that support range, but have some reason that their fiscal needs would exceed that. So more to come on that as we move forward.
And
Great things to highlight. Thank you.
Mm-hmm.
This is Kylie from the Improve Group. I do just want to acknowledge, I know more questions are coming in and we are continuing to write them down. So we'll make sure the answers get back to you all, but we also need to wrap up.
Great. Thanks, Kylie. This is Jill speaking with the Improve Group. And with just a few minutes that we have, I want to close it out here with the next slide, Jim. Let's see here, ways to stay engaged. These websites here, again, you were provided with this PowerPoint slide deck and your handouts last week in preparation for this event here. And so you have the information there. We're just displaying it here just to remind folks that you can visit the Waiver Reimagine website. That link is provided here. Email DHS at the waiver.reimagine@state.mn.us with any questions or input about the Waiver Reimagine. And you can also subscribe to receive the DSDE list announcement by going to that link there. Thank you again. So folks, there are ways to stay involved. There are ways to stay connected. Please access those sources. And thank you all very, very much. Have a good night, everyone.